Right, it's 12:35, so I'm going to make a start. If others join us throughout the presentation, hopefully we can play catch up. But thank you for joining us this afternoon. Much appreciated. This is the learning lunch. Try that again. The learning lunch. My name is Chris Elkin, and I'm the head of healthcare. So we're going to take about 20 minutes of your time, and we're going to go and show you a little bit about Piota, what we do, who we do it with, etc. So this particular presentation this afternoon, power of apps in patient care and staff engagement. So yeah, let's get into it. So just a little bit about me, just to start off with. I've been in the industry now for 20 odd years, spent 10 years working directly for the NHS, producing a whole raft of different electronic media for them. So responsible for their internet and intranet management, created some award-winning apps while we're there. But deep down in me, it's all about making it easy for people. I think everything that we've created has always been looking at the users and the user experience and just trying to make it easier for people. If people don't have to think about what they're doing, they're more likely to complete a task. If they have to stop and think and there's a decision to make, or not quite sure about this, then people sometimes do give up. So the easier we can make it for people, the better. Piota. Piota stands for Put It on the App. We're a leading provider of support apps to the NHS. We deal with about 140 different clients now, right across the NHS, and they range from all the way up the top to NHS England, Public Health Wales. We deal with about 8 or 9 of the healthcare boards up in Scotland, lots of ICBs, ICSs, trusts and different teams. So, working with a good range of clients right across the piece. We've got an app platform. So it's about, looking around in today's modern world where everyone's on the phone, the majority of the time. I've got a computer here for work. I've got my laptop again for work. But, till the end of the day, I'll close those machines down and I'll use my phone, of an evening or of a weekend. That's my kind of go-to device when I'm looking to have information. Purely because it's portable and accessible wherever I am. It's just easy, isn't it? And we're coming back to that concept again about making things easy for people. So this is the first kind of look at one of our apps. All our apps look the same. It's a platform that we're providing. So we will work with you to understand the pathway, the journey, the information you're wanting to share and provide to your patients, families and carers, or more recently, we're doing a lot of work with different workforces. So all our apps look the same. We can have some kind of branding at the top half of the screen, a logo, an image, something of that ilk. And at the bottom half of the screen, we've got these, what we call the tiles. These have labels, and then there's certain information, certain functions that go behind the scenes with the labels, with the different tiles. So these are just sort of examples of some of the apps we've created and for some of the organisations we work with. So as I say, historically, lots and lots of patient families and carers. So, healthcare teams like this up in Scotland wanted to use the app to provide parents with lots of information about their kids' nutrition, all wrapped up in handy app. So once it was downloaded, the app's on their device, they can click a button and hey presto, they've got access to it. So they use things like push notifications and alerts to provide parents with menus and different things that will assist them, different classes or different physical activity classes that are happening within their area. So just a real good way for that particular team to have a direct contact with their families, with their patients, which they can quite quickly and easily manage themselves. And a lot of these teams that you see, this is a youth team for transition. This is for, I think, pre-op for a hospital up in the NHS Tayside. A lot of the teams we work with sort of have the same sort of story, that they're desperate to improve engagement and communication with their audiences. But the resources within their teams are somewhat challenging, whether it be IT or whether it be comms or whomever it might be, they're not able to respond quickly and effectively with some of their requests. So a lot of these teams have identified that we want to do things differently, and we need to find a partner that's out there that allow us to, to meet our aims or meet our objectives. And to date, that's, we're one of those particular suppliers. So as I say, lots of apps for lots of different teams, different organisations. We had one there for a care home. This one's for an estates team. That's a large trust in London. So we're doing lots of sort of wellbeing apps for organisations, and especially for teams where they're working in clinical environments, let's say, for example. So they may not have access to the internet, or may not have access to the internet or emails. So being able to provide, as an organisation, be able to provide a lot of this sort of well-being information, support information, benefits information, all on a quick and easy to use app, has become very attractive for a lot of workforce teams. So let's just give you some examples. I think I've got 4 different examples here of different teams that are using the app in different ways just to improve overall communication. So let's look at patient experience to start off with. So yeah, as I said to you before, personally, I use my phone wherever I am, to browse the internet, to use my favourite apps, to look at the weather or shopping or travel, whatever it might be. And this is the same for everybody, isn't it, these days? We're all using our phones. So as a team, why wouldn't you want to be able to deliver information directly to people's devices that have got on them the majority of the time? But this one, as I started at 10, is for a hospital up in Morecambe Bay, and this one was for their maternity team. So the app was commissioned by their digital midwife, and their administration team keep this sort of up to date. But as you can probably appreciate, a lot of the information here is fairly static. So once the information's been produced and put onto the app, it's kind of there, and then they use the app to send out notifications or changes of service, or different things that are happening within the team. And they can send those out on a sort of ad hoc basis. But as I say, we have these tiles on the front of the screen with different aspects of the information they're wanting to provide, the different journey or the pathway. And they produce their own content. We license them under the platform, and that allows the administrator then to put information directly into the system. This one's right at the beginning of the journey, and there's referral forms which they can link out to. They've got embedded YouTube videos, so you can see the birthing centre that you'd like to, have a look around the birthing centre that you may want to go and give birth into. Lots of information about the different services and the different networks that are available. Obviously, very much information about newly borns. So what we're not looking to do here is reinvent the wheel. There's lots of great information out there, and lots of our teams favour, different sources of information. So a lot of these apps are signposting. We're introducing a subject, but we're signposting you over to other resources. Whether that be NHS websites, or whether that be other websites that's got information on there. We can use the app just to sort of signpost and have this sort of one-stop shop, where as a user of the system, I can be confident that all the information I need about whatever it might be is all in this one place, and it's provided to me by my team. All of the apps have the ability to have sort of contacts directory. So again, pressing any of these buttons would take you through to that particular team, and we're just trying to make it easy for people. Phones are wonderful things. They've got lots of great technologies, and our platform integrates into the native functions and allows you to make phone calls, or look at websites or look at maps for different things. So again, as a new parent or grandparents, I can pull out the app, find the contacts page, press a button, I can be speaking to somebody in that team. I'm not having to try and get numbers, or try and remember numbers, or try and transpose numbers from one device to another. It can all be done relatively quickly and easily. Obviously, we've got push notifications and alerts. We've all got our favourite apps on our home screens on our devices with those little round circles with those numbers next to them, indicating there's something new. And it's the same with the apps. You can create a little update and send that out to everybody who's downloaded the app. It's just a real good way of keeping in contact with people. A little digital tap on the shoulder. There's been an update since last time we spoke, or last time you looked at the app. So this one's a different audience. So this is for Macmillan patients at Chesterfield Royal Hospital, but it's the same principle. It's the same platform, slightly different look and feel, slightly different colour. But that is an image of the Macmillan Information Centre, and the apps again have been agreed with the team, and this is the sort of information that they're wanting to provide. So whilst this one's primarily aimed at cancer patients and their carers and families, there's also a section on here for professionals as well. So again, it's a bit of a one-stop shop. Anybody can download this and put it onto their device, but it's providing the patients up in the Chesterfield and sort of North Derbyshire area with all the information they need about the support that's available. They've got ability to access different Macmillan sites and different resources there. There are different schemes that are running within the region or within the community, and all of this can be found directly on the phone. So everything that person needs to know is there, and it's available. It's available 24/7. It's once you've downloaded it, it's always going to be there. And it's just quick and easy to find. You might not want to be in a position to absorb all this information initially, but when you are ready, or when you do want it, you can open up the app, click on a particular section, and find information that's relevant to you and relevant to where you live, as opposed to looking on the internet trying to search stuff down that's fairly generic and doesn't necessarily suit your needs or requirements. So lots of fantastic information. Within the app, you've got the ability to translate into different languages. So a quick click on a couple of buttons will initiate the Google Translate engine, and the app can be translated into that particular language. Again, this one's got a contacts page with different contacts on there. A quick press of the call button will take you directly through to that team, making it easy for people. That's what we're all about here, is just making it easy for people. So a couple of examples there of apps which are being used to improve the patient experience. These are a couple of apps, it's the same platform, but looking at how we can improve staff engagement. And we do lots of work with different teams, looking at different areas. So recruitment, education, retention, to name but a few. But a couple of ones that we've got in here, I'll go on to are sort of well-being and operational app. But for clinical folks, I guess you can sort of look at some of these images and kind of relate. It's very difficult to get access to resources, perhaps whilst at work. But when you're back home and you've had a minute and you've chance to sort of relax, then you'll probably pull out your device and somebody told you about an event, or somebody told you about a bit of training, or somebody told you about a network session. That's probably the time where you're going to want to sort of reflect and try and dig this information out. So having it all in one place is kind of key. So let's have a quick look at this one. This one is from St Helena Knowsley, so a big trust up in the north west. And this is all about staff engagement. So really looking to provide everybody with the same experience. We talk, or the NHS talks about the people's promise, and ensuring that we provide an inclusive service and everybody has the same opportunities. But time and time again, we're being taught to, or being told by clinical teams, that we just don't have access to their computers during work time, and we can't get onto the internet, or emails are a bit of a no-no. So being able to have an app where, in this particular one, all the benefits they've got as an employee for that particular organisation, all of the wellbeing events, all of the support networks that are available, all of the jobs that are around, it just provides that kind of one-stop shop and ensures that everyone's included within these, within these different schemes or these different conversations. So same principle. Bunch of different functions there, all labelled up to ensure that they meet the needs of the organisation, and they're intuitive. As somebody picking up this for the first time, it's fairly simple what these different things do. But if we get straight into it, so information about different events and things that are happening within the organisation, about the different networks that are available. So again, back to this sort of idea of inclusiveness, making sure that people are aware of these different things that are happening. Within this one, it's got a section on the different technical platforms. So, as the workforce has changed slightly within secondary care, some teams can work from home from time to time, but all of the platforms that they may need to access, so likes of ESR or rostering systems or Teams or emails or whatever it might be. Again, these are all listed within the app, so anybody picking these up or anybody working from home can get onto the app and just get all the detail they need so they can start working quickly and effectively. It doesn't have to be long-winded, you don't have to be searching around for it. Just put it all in one place, make it accessible, and people will come. So this is a section on all the different benefits that are available to that particular team. Again, my alerts. So using this all the way through to keep people aware of different events that are happening, whether it be social, whether it be work, whether it be training and development, just keeping people in the loop in terms of everything that's happening within the organisation. Everyone's got phones on them, they're all in our tunic pockets or on our persons somewhere. So to send a quick alert out there, a little vibration in your pocket, there's a new event on, there's a new training session, or, we've got having a social event. It's just a real, like I say, a real good way of just keeping people informed of everything that's happening. This was a great idea. They used this throughout the pandemic. So, I mean, that's a couple of years ago, isn't it? It's still sort of fresh in everyone's mind. It was a pulse check. So within the app itself, you've got the ability to create simple forms or surveys. And if you've used things like Smart Survey or SurveyMonkey or even Microsoft Forms, it's that sort of capability where you can create simple forms and then get your colleagues to complete them. In this particular one, it was asking people how they were feeling, during the pandemic. Have you got the right leadership? Have you got the right equipment? Are you confident? And just little 2 or 3 questions that they were posting out periodically, using push notifications and alerts to grab people's attentions, was just a really ideal way of their organisational development team getting a feel for, what was happening within the organisation. So again, just using simple forms, but it was the phone, the mobile device, the app that made this form much more accessible to people. The last demonstration I'm going to show, I'm conscious of time, is increasing information efficiency. So again, within a clinical area. So the guy that led on this was their sort of technical medical consultant. So, worked within the team, but was responsible for ensuring that they met the KPIs and, they were seeing people promptly and getting people through the service. So, really had to take a sort of step backwards and just observe the team and how they were operating, and started to identify some patterns of behaviour. Their workforce was very transient, so they've got a lot of sort of permanent staff, but equally they've got a lot of junior doctors and medical students and locums that were helping out, and whilst those staff groups were very capable of doing the work, there was just the little policies or the little bits of information that they weren't quite sure about how they did it at this particular organisation. So the consultant observed people just leaving cubicles just to dash off and do a quick run over to the nurses station in order that they could get a quick look at a policy or a procedure or an algorithm or an SOP, whatever, just to make sure that they were giving the correct and right advice. And I've seen this a lot, and logging in, logging out of computers isn't necessarily that speedily and efficient. So I was just seeing people, just spending a bit of time, perhaps too much time, on the nurses station, and just thought there's got to be a better way, So produced the app, and this has got all of the guidelines, all of the policies and procedures, and the whole idea was, as a qualified medical professional, I could be having a conversation, I could be in the triage, in the cubicle, and whilst I'm talking, I could be pulling this out of my pocket, having a quick look at all guidelines, finding the policy, finding the procedure, getting to that little nugget of detail that I wasn't sure about, without breaking voice or breaking the conversation. I'm back in the room and I can give you that advice. So really looking at, just as I say, being able to provide that information a lot more efficiently, to be able to save time for the team, which ultimately meant more patients flowing through the department, which I think for any ED team is the big challenge. So same principle, same app, bit of branding, just looked at the interface to make sure that information can be found quickly and easily. With this one, because there is lots of policies, procedures, phone numbers of different clinicians and consultants and etc., you have to be registered. So this is a list of email addresses within the back end of the system. You come onto the system as a user, put in your email address, send you a 6-digit code, you put in the 6-digit code, and then it binds your device to the system, so it knows who is using it and who can use it. So it's got restricted access on this one. But once you're in there, you can go into one of the policies areas, and these are all policies and procedures, I think, looking at it for the trust, but then you've got different guidelines for peds and different adults, and clicking into any of these sections would give you a list of all of the different guidelines, policies, SOPs, and clicking onto one of those would open them up immediately. So you've got that content within seconds. Just a really quick and easy way. Once people started using it, it was, it'd be great if it could do this, and it'd be great if it could do that. So, taking a step backwards, yes, it's operational, but how can I help my colleagues? How can I make their lives easier? So included links to rosters. So you didn't have to be in work to go and check the roster. You could quickly log onto the app here, and that would take you to the rostering system. A whole bunch of different forms. So again, rather than having to stop behind after your shift or try and squeeze it in before or after your shift, you could access this walking out of the trust, sat in the cafe, on the train, in the bus home, whatever it might be. So lots of different forms here, and these are the same sort of principle as the form that we talked about previously. It's a simple to use system, a bit like Smart Survey, SurveyMonkey, Microsoft Forms, that allow you to create quick forms. You can create a form, and then the responses within the form are collected within the system, but can then be distributed to various different inboxes. So things like the annual leave request form, that would go to one of the administrators who would be responsible for collecting those, that information. Similarly with handover sheets, that would go to another administrator who was responsible for collecting handovers. These, just again, it's just trying to create efficiency within the system, trying to save valuable time so they can spend more time doing the job, which is looking after patients and and not following bits of paper around the place. They've got a directory here, and again, just thinking about what do our colleagues need. So, joining up the dots. But there's the big old list here of all of the different consultants, the different outpatient clinics, the different teams that there may be, sending them to out of the hospital thereafter. So just a real long list of different people that they could scroll through, find a phone number and speak to that person very, very quickly. So just, again, making it easy for people. That's what it's all about, making it easy. Gone on the stage further, put mandatory training on there, but it could be anything. As an organisation, it's up to you what sort of information you're wanting to share with your, with your audiences, whether they be patients, families, carers, or potentially new patients, or colleagues, staff. It's all about how you want to set this up and how you want to provide the information to your audiences. So just a real simple solution. What does that look like in terms of the tech? Two aspects. Phone on the right hand side is the mobile phone, which we can configure to meet the needs of your organisation. On the left hand side, as I'm looking at it, is the content management system. So web-based, cloud-based platform, you can kind of log in, you can go into any of these sections and you can create a new page, and you can add images, and you can add links to websites or embed YouTube videos. It's a real simple to use interface. A lot of the functions you're already familiar with because you're using Word or you're using PowerPoint on a regular basis. Nothing difficult in here at all, but real powerful toolkit. Allows you to create the content, get it distributed, send alerts and notifications if you want to, and you can do that within minutes. And anybody can do this. You don't have to have a comms team, or you don't have to rely on an IT team and send emails off and they don't come back for weeks. You can just pull the system up and do it within minutes. It really is super simple. In terms of process, if you're interested in having a look at this, give us a shout, get in contact with us. We'll create a Teams meeting on Google Hangouts where we can talk a little bit more about the challenges that you face. I dare bet that we've got an example of some work that we've done for somebody in a similar sort of scenario, and we can kind of show you what other people are up to. So we can start to really delve into how the app could help within your particular areas. If you're genuinely interested, then we'll produce a free trial. So you can put that in the hands of your colleagues, or put that in the hands of your patients, start to get some feedback, get their thoughts, get their ideas, start thinking about what it is that they may want. Obviously you'll have your primary challenges, and this is what we're wanting to do, but once the apps are out there, they can do a hell of a lot more, and you can add and bolt further sections of information on as and when you're aware of it. But yeah, go through the trial. Does it work for us? Yes, it does. Then it's just about the formalities. Let's get some agreement from the organisations, get the paperwork done, get the boring bit out of the way, and then we can get on to the sort of project itself. But at this stage, we'll probably have built a trial app. You'll have been onto the back end of the system and then seen how easy it is to create the content yourself. As a partnership, we'll put some content into the app, so you've got something to show, as I say, and there'll be information in there and people can see it working in context. And then it's a matter of getting you up and running. And at that point, when you've launched, we almost take a step backwards. So, we've provided you the training, we've provided some good practice and some the benefit of our experiences. You've got your app up and running, you're comfortable and confident with the platform, and you can run it. And then we take a support, a support role. So we'll just be behind you should you have any information requests or any technical glitches you might find from time to time. You can report them to us, and we can kind of help out. So really, really easy. It's not super expensive either in the grand scheme of things. So it ranges from anywhere from about £3,500 a year to about £10,000 a year, depending on how many users are going to download and use the platform. So for some of the smaller apps, for some of the team apps, we're kind of on the lower end of the scale. For some of the more public-facing apps, we do a lot of work with COPD and dementia and those sort of cancer apps, where the audiences are a lot bigger. It's more towards the sort of 10 grand a year scale. But yeah, it's just a quick testimonial there from one of our clients. I think at the beginning of the pandemic, because we've got this platform, it's in situ, it's kind of good to go. We were able to respond very, very quickly, and we had an app out there within a day. They wanted to share all of their information with their care home staff. Wanted an app to be able to do that. They came to us with the challenge in the morning, and by sort of late afternoon, they were emailing out all of their managers, asking them to encourage their colleagues to download the app. And this is the way that we're going to be sharing information kind of going forward. So it all comes back to, the mantra about quick and easy. It doesn't have to be complicated. It doesn't have to be difficult. It shouldn't be long-winded. This is relatively simple stuff, but really, really effective. We're doing lots of work with lots of big teams that have got lots of benefits of, of working with apps and, providing extended information to their audiences. That, I believe, is me for today. So I don't know if we've got any questions. Let me have a look in here. I think Philip's possibly writing something. Sarah, I don't know if you've got any questions. I'll put a hand up. I'm not sure whether I can unmute you or whether you can type into the chat your question, and I can answer it in that way. If that works for you. Let me see if I can unmute you. Oh, hello, Mike. Let's do this. Sarah, are you there? Bill, just looking at your route, it looks fabulous, but it seems to be aimed at large organisations. Large or small organisations can use this. We do a lot of work within the voluntary sector that use their apps to keep their members informed. We do lots of work with lots of different places. So the audiences are the same, whether it's small or large. It's just providing that information to them, isn't it? Sometimes I guess the smaller audiences are sometimes more difficult to keep abreast of or keep contact to. So if you are interested, Phil, and you wanted to you wanted to take it a little bit further, come and talk to us. Let us know. Let's have a chat about your organisation, how you do things, and how how it could be better, or how something like this might help. And we can see where we go. But this is not. There are lots of large organisations using it, but it's not it's not specifically aimed at large organisations. As I say, anybody can use this, really. Sarah, can I have a copy of the slides? I was going to put managers, put this in practice for staff. I'd love to show my managers. Absolutely no problem at all. What we'll do is we normally will write to you thanking you for your time today, and there will be a link into this video if that helps. We can certainly, Sarah, we can certainly put the slides together as a PDF as well and add that. But that link will be in there for people to be able to review thereafter. And if you've got other colleagues in other practices or in other industries that might be might benefit from a conversation with us, do share the links. Do share it with them, and as I say, do reach out if you're interested, because I'm sure we've got a story to tell you. So. Unless there's any more questions, I'm conscious of the time. I know we started a little bit late, but I wanted to try and keep it to half an hour if we can. I know we're almost there. I can see Sarah typing a message. Oh, are you going to be at the best practice show? As if so, I will pop by. Unfortunately, I won't be at the best practice show, but some of my colleagues from a sister company maybe. We'll get back to you on that, Sarah. We'll reach out to you and kind of let you know. But as I say, if you are interested, give us a shout. We will send you a link to the video so you can watch it, as and when, and share that with colleagues. But unless you've got any more questions, I want to thank you for your time this afternoon, and hopefully our paths will cross again. Thanks everybody for the time. All the best. Bye bye.